Hi, my name is Jennifer Hall and this is Preston, and we are here for the PTEN Patient Symposium. And I was just going to tell you a little bit about Preston's journey and our trial at Boston Children's that Preston just completed in February. Preston is 10 years old and he's a twin. They were both born at 30 weeks and spent time in the NICU. And some of our first things that we found with Preston was we found that he had a craniofacial disorder. So when he was about 6-7 weeks old, they discovered this, and we knew that he would be having a big skull revision surgery when he was right before his first birthday, around 10 months of age. So he had that, and we knew that we were experiencing some delays along the way. And his craniofacial surgeons and neurosurgeons felt like he must have something other than a craniofacial disorder. They thought maybe he had an unidentified craniofacial syndrome. So they kept kind of digging for answers as we were having issues with failure to thrive, respiratory issues, GI issues, and just kind of not finding, he wasn't quite fitting into just a single fused suture patient. So when he was about 6 years old, we discovered that he had PTEN, and then that kind of took us on a journey, and we ended up at Boston Children's this summer to transfer his care. We're from the Dallas area, and he had his craniofacial surgery in Dallas, and most of his team was in Dallas. We had a few doctors in Fort Worth, but we ended up at Boston and met with people there and decided that we would do the trial that was just then starting. So Preston enrolled in the trial in July and got started, and we pretty much within about 2 weeks, or it was about 4 weeks of starting, that we had suspicions that he was possibly on the drug and not the placebo. We saw differences in his communication and just like its interactions that we were having. And then we started experiencing some just gross motor changes. And what do you like to play? What was the thing you like to play a lot outside?
iPad. Baseball!
He likes to hit the baseball. And we started seeing him being able to make contact with the bat, and he was playing outside and just having lots of fun. Preston is a really happy kid, and he loved going to Boston, even though it was a bit of a journey for us, and we had a lot of traveling over the last 6 months. It was such a great experience, and we got to meet a lot of the people on the research team, and we were just really thankful to be a part of it. And Preston did a great job, and we did find out at the end of the trial that he was actually on the drug, and he really did well, and we think we saw some significant improvements, and we've seen them continue in the month that he's been off now of the drug. So we're thankful to be here, and Preston is a joy, and we love him, and he loves life. So thanks so much.